Everyone from wherever you are joining us from this morning. We want to especially welcome you to Intercession of Faith and Medicine 6.0. And we are truly delighted for joining this meeting this morning. And we hope that everything that has been prepared for, that you will get it. So once again, you are welcome. And we believe that this section will be a powerful one for you as we join perfectly. So you're welcome once again. So leading us on, I'm going to be inviting Dr. Tunde Ayankola as the lead us on in an opening prayer. Dr. Tunde Ayankola, you're welcome, sir.
All right, thank you so much. Let's bow our hearts for prayer. Heavenly Father, we thank you for this day that you have made and we rejoice in it. Lord, we thank you for this vision that you are giving to our Father, Mother, and the Lord. We thank you because you have a great plan for all of us. Lord, we ask, Lord, as we go through this, unraveling the mystery and every hidden agenda of the enemy as related to addiction. Lord, we ask, Lord, that you supply understanding and let our life be better for it in the name of Jesus. That will be an instrument shining light, imparting life, transforming them into the perfect image of the Lord Jesus Christ. Father, we thank you as we go on, that your presence will go with us. And we know at the end of this session that we'll have every cause to give glory to your name. Father, we thank you because it is so. In Jesus' mighty name, we are prayed.
Again to another session of Intercession of Faith and Medicine 6.0, and moving on, we'll be taking a brief introduction about OADI. OADI simply means Olushola and Oyinike Development Initiative. We are a Christian non-governmental organization and the development arm of Shola Areogun Ministries, where support is given and love is shown to the vulnerable and less privileged individuals and communities, thus empowering them to fulfilling their dreams in life. We identify and tackle socioeconomic and health-related problems that subject people to poverty and or threaten their state of living a balanced life, whether physically, emotionally, spiritually, and socially. We focus on three thematic areas: economic development, social women empowerment, and community development. And for the educational development, we have the Destiny Scribes writing competition. We have the OADI undergraduate scholarship. We also have the Operation GLAD. And then for the women empowerment, we have the Tabitha Project, where we visit schools, community, where we train and teach girls about life experiences. And particularly, we focus on ministering the gospel to them, which is very, very important to us. We'll also give them things that they need for their daily lives. We are very particular about advocacy and awareness. We've also organized different medical camps. We go to local communities to address issues that affect women and girls. We'll also have the Destiny Vocational School, which is about training women about skills, different skills, be it graphics, baking, etc., to just ensure that women are equipped. And lastly, we have the micro credit scheme, where we focus about entrepreneurship. We help women and girls to scale up their businesses, and also, in turn, they generate income. If you are new to OADI, you do well to visit our website, where you have a broader view and more understanding about the foundation and what we stand for. You can visit us at www.oareogun.com. That is devinitiative.org, or you can also send us a mail at admin@ooreogundevinitiative.org. So relax, sit back as we go on unraveling this mystery about drug addiction. And now I will be welcoming our Chief Executive Officer in person of Ms. Peace Areogun to give us the welcome address. You're welcome, ma'am. bachelor's degree in English and master's degree in international management with HRM from reputable institutions. She has worked she has had a working experience in academia as well as in other sectors. She has end-to-end HR experience from various sectors and manages the HR operations in the initiative. Ms. Arelgo is an avid reader. She's a writer. She's also an education enthusiast. She's an entrepreneur. She's a speaker. She's also an advocate for the girl child, as well as for promoting a reading culture among young people. The Destiny Scribes writing competition is a brainchild, an initiative which began as an in-house writing competition for Destiny International College. So join me as we welcome again our Chief Executive Officer, Ms. Peace Arelgo. You are very much welcome now.
On behalf of the founder and Oyenika Areogun Development Initiative, that is OADI, I am honored and deeply grateful to welcome you to another edition of Intersection of Faith and Medicine 6.0. And today we gather, as people who care deeply about healing, restoration, and the dignity of every human life. Drug addiction, as we know, has quietly become one of the most pressing issues and least openly discussed challenges of our time. Many are suffering in silence, unsure of where to turn. And this is why this year theme, as you've known, is the silent epidemic. So unveiling the hidden truths about drug addiction is very, very important. And at OADI, also as many of you has known, as our work is very rooted in love, compassion, and a commitment to holistic development that are addressing not just the physical needs of people, but also the emotional, the social, and the spiritual well-being. So we believe that no issue is beyond redemption at OADI. We believe that when truth is spoken, when understanding is shared, and help is made accessible, there can be deliverance, there can be healing, there can be change, So this platform of Intersection of Faith and Medicine was created to bridge two powerful words that can work together, and that is faith and medicine. Addiction is not just a moral issue. It is not just a medical condition. It's a condition it can be spiritual, it can be moral, it can be a lot of things. And so it requires a lot of empathy, knowledge, prayer, professional care, and community support. And today you will hear from seasoned medical practitioners, pharmacists, and spiritual leaders who will help us to understand the root causes of this addiction, recognize the patterns, the sign, and explore the pathways to recovery and freedom. So if you're joining us today because maybe you're seeking answers for yourself or for your loved ones or for your community, I encourage you to approach this conversation with open heart, humility, and compassion. There is hope, there is help, and there is healing. So, and I express my sincere appreciation to the speakers, to the anchors, and all the OADI team who were working to contribute to the success of this program. Thank you so much. May God bless you all. And on behalf of our CEO, Ms. Peace Areogun, you're welcome. Thank you. Over to you, anchors.
And now moving on, we are going to be listening to an impact story from one of our beneficiaries, and afterward we welcome our keynote speaker. But before we move on to our keynote speaker's presentation, I would like to welcome the IT team to lead us further. You're welcome. Thank you so much, sir.
Beneficiary of the OOADI initiative. What is the OOADI initiative? It is the Olushola and Oyenike Areogun Development Initiative that targets Christians that are in the higher institution of higher learning, that are living for God, passionate about the things of God, and still actively participating in their academics. Up until this moment, I still include the scholarship award that I received from the foundation even in my resume, because I am proud of it. It has become my success story, and it's part of my identity that I did receive an award from this foundation, because it made a great impact in my life when I was still in the university. Now you may ask me, what kind of impact did OOADI make in my life and in my journey till today, that I am so proud to put it even in my resume? Because when I was in the university, I was from a Christian background. I am still a Christian, but when you are in the university, you come across students from different backgrounds such as you, but are not living as passionately as you are for God. And you see people getting distracted, or even going after the things of the world, or even people who are very zealous for the things of God, are very involved in church activities, but are still struggling in their academics. But with that scholarship foundation, it gave me a focus and a clear view. It made me to be conscious and aware of the fact that even though I am a Christian and I'm living for God in my university, my days in my church group family at that time, I can still have academic excellence. In my first year of university, I had the choice to pull back from following after God and going to church as much as I used to, and concentrating on my academics so I can come out with a first class or have good grades. And that challenge was there, because university gives you the freedom to do whatever you want to do and make choices about your life that will have great impact in your future. At that point, I made the decision that I was going to continue to seek after God passionately, because I put my trust in God and I knew that it was going to get me through university. Even though it was difficult, I had to read more, because I had to combine going to school fellowships, going to church, and also reading my books, preparing for exams and tests. And of course, I had advice along the way that I should slow down from the things of God and concentrate on my academics, because at that time when I was in my first year of university, I was in a department that I chose based on convenience. It was not my dream department. I wanted to study nursing, but I was in a different department, and I was planning to transfer to the nursing department in my second year. So it was very important for me in my first year to have a GP higher than 4.0. So I was aiming at that. So that was enough excuse for me to pull back from church attendance, to pull back from intensive fellowship activities, to pull back from following God, to focus on my academic pursuit, because I was trying to meet up a particular GP so that I can transfer into the nursing department. But I kept trusting God. I kept believing God that I could do all things through Christ who strengthens me. And I did receive God's grace. I was able to have a GP higher than 4.0, and I was able to transfer into the nursing department, even with my strong involvement in church and fellowship. I applied for the Academic Excellence Scholarship award because I felt I needed a little tap on the shoulder, a little charge and says, yes, you can do it. Throughout the selection and interview process, the entire process was smooth, was professional. I did not feel intimidated at all, but I felt challenged to think about what my life goals were, what my short-term goals as well as my long-term goals were, who my life and career mentors were. So the questions really created an hunger in me to think and aspire for higher things in life and in my career. So I'd like to say a big thank you to OOAD Initiative for their support when I was in my university. It made me to realize that I had to make big plans for my life. I had to dream big and think in advance for my future. I had to choose the right role models, and it was a great encouragement for me that I could keep pursuing God and also pursuing my academics actively and win on both sides. Thank you very much for your support. So my advice to any students in the higher institution out there, whether you are struggling financially or you are just trying to get an encouragement for living the best life for God on campus and also actively participating in your academics, you can apply to the OOADI and you can get a scholarship.
Welcome back. And now we are going to be inviting our keynote speaker in person of Dr. Tunde Ayankola. But before we invite him, I would read his biography. Dr. Tunde Ayantunde. Dr. Tunde Ayankola is a distinguished addiction specialist with 15 years experience in mental health practice. He currently works as a senior consultant at Drug Abuse Treatment, Education and Research Neuropsychiatric Hospital, Aro, Abeokuta. He's a visiting consultant at Wellness Center, Babcock University Teaching Hospital, Ilesan Remo. Is a medical director, Stillwater's Addiction and Psychotrauma Rehabilitation and Recovery Center, Osogbo. He is a global research awardee, a fellow of the West African College of Physicians, member of International Society of Addiction Medicine, member of Nigeria Society of Addiction Medicine, member International Society of Substance Use Professionals, member American Academy of Addiction Psychiatry. He is a major contributor to Nigeria Epidemiological Network of Drug Use, NENDU, annual report writing, and is actively involved in public engagement and community sensitization on substance use treatment. Dr. Ayankola, in addition to his secular work, is actively involved in church life and he currently serves as a deacon and coordinator in his church base. He is happily married and blessed with 2 children. He enjoys visiting his farm. He engages in sporting activities during his leisure time. So join me as we welcome Dr. Tunde Ayankola as he takes us further in his presentation. You're welcome, sir.
Thank you so much, the moderator. I mean, it's a great privilege to be here. And I want to thank my father and mother and the Lord for this privilege to be the keynote speaker at this special program. And I must say that when we talk about addiction, it's something that is of a concern to me, and I'm passionate about it. Yes, so I'll quickly go through some of the presentation that I prepared for our understanding. And I want to believe that some of us, we have questions. So please, you can drop your questions in the chat box. So at the right time, we'll look at some of them. Yes, so I would like to share my presentation. Or do you have it over there, moderator? Should I share from my hands here? Okay, let me share from my ends here. All right. Sorry, I don't know. Do you have it? Please, can you wave your hands or raise hands if you have it? Can you see my slide? Am I audible enough? Oh, all right. Thank you so much. Thank you for that feedback. Yes. So when we look at addiction is a major issue. And believe me, as we know, human being, we are spirit, soul, and body. And the tripartite being that we have. So there is always an intersection between our faith and medicine, between our body, soul, and the spirit. And when we look at mental health, look into the mind aspect of our being. And believe me, the spirit is who we are, and it's the one that directs a lot of things that goes on within us. So it's very important that we understand the intersection between faith and medicine, so that we should know when to give attention to the medical side of our being, and also looking into the faith side of it. So medicine and faith is a, now just as we are know that we are believers, the Bible said in the third book of John, chapter 1, verse 2, beloved, I wish above all things that thou may prosper and be in good health, even as thy soul prospereth. So God's plan for us is that we should prosper in all dimensions, in our health, in our soul. And medically, we talk about health is not just the absence of disease, but the state of well-being. So the state that you are at a particular time, we look at it from that you should be healthy in terms of your physical health, your mental health, and your social, and importantly, your spiritual health. And when we look at God's plan, faith and medicine are God's provision for us to overcome the enemy, which the various way that the enemy comes against human being, that comes against us right from the foundation, right from the creation. The enemy is after us. And that is why faith and medicine is God's provision for us. And this also includes even addiction. So addiction is one of those things that the devil has created to stop the destiny of human being on this earth. And that God has made a better way for us through the salvation that we've gotten through Christ, our Lord and personal Savior. So because of this, we'll be going through some times, which I just think, just for enlightenment purpose, and just to call our attention to some of those things that we may be talking about, because there might be some misconception about some things. When we talk about drugs are things that one way or the other, they affect our physiological states. When we say physiological state, is the way the body functions, the way the body responds when those substances get into our body. So anything that we take in that influence our physiological state, the way they function, that affect directly or the body react to it, those are drugs. And now that means virtually a lot of things, which include some of those things that we'll be talking about in the course of this section. Now, psychoactive substances are things that one way or the other affect the way people feel. If for any reason somebody takes something and it changes that individual modes of feeling, then that appears to be a psychoactive substance. Yes, we may talk about prescription drugs. These are medicine that is an authorization that we are getting it. So they are quite different from over-the-counter drugs that you can walk in and without any prescription get. So these are some of those things that we need to give attention to. Also, drug abuse is the use of mood-altering drugs that interfere with negative effects of a person's life. So if for any reason you are taking a substance and is affecting your mood, is altering your mood, and in the course of that is giving negative effects to such an individual, whether physical, psychological, social, and even spiritually, maybe it's affecting that individual. Occupation is no longer able to function effectively, or the person is misbehaving, or on account of the drug use, that person start having maybe hepatitis or having some brain dysfunction, or it's affecting his interpersonal relationship, then we start thinking that this is a drug abuse that person is having at that particular time. Now, addiction and drug dependence, they are words that are used interchangeably. Professional, we use drug dependence, while layman, we say addiction, and we describe addiction as a primary, chronic, progressive, and disabling condition. And what we mean by this is that what we are seeing, the outcome of this, which we talk about, the outcome, the effect of the substance, we can attribute it primarily to the substance that individual is taking. And when we say chronic, when addiction sets in, we say that individual is going to live with it. It's a lifelong illness, just like hypertension, diabetes. However, God has a divine provision for us that no matter what the devil has done, God can turn it over. And addiction is progressive. So it doesn't stop. If it's not managed, it gets worse. In my practice, I've seen a lot. You've seen from stories, you really feel pitied. Someone that started well, promising child, get to a higher institution, and before you know it, someone that should have finished with first class, they end up becoming a dropout, or someone that has a successful business and everything just gets wrecked. So it's progress, it gets worse. It doesn't just stop. It takes life gradually, and before you know it, an individual may not be able to function again. Now, when we're looking at drug, generally, we classify drugs in various ways. some of the way that we classify drugs. I hope I'm audible. Can you hear me? Thank you so much. Yes, so we classify psychoactive drugs, which we'll be talking more about, that affects the way an individual is. We say we can categorize them based on status, how the society classify, how the society look at them. So we can say some are legal, while some are illegal. And when we say some are legal, we talk about based on the law. The law permit that people can take tobacco, even though it's a psychoactive substance. In Nigeria, it's permitted that you should take alcohol. In Nigeria, cannabis is illegal. So just to help us to differentiate that, under the law, there are some psychoactive substances that if somebody takes it, it can be arrested and prosecuted. Also, we can categorize them based on the chemical components of that is in those substances. For instance, when we look at opioids is a wide range, and in it you have a lot of psychoactive substances which start from pentazocine, tramadol, codeine, fentanyl, and the rest. Now, in terms of medical, we have non-prescription and prescription. You can also classify based on that. And also you can classify based on the action and properties of this psychoactive substance, which we quickly look into now. We can classify them based on depressant, because I think this is more important for us. Probably you have someone close to you. How do you know whether you are suspecting or not, or whether somebody has stopped using depressants? There are some features that come with depressant. Everything goes down. While stimulants, everything is on the hype. They are very active. They are agile. They are irritable. Everything is on the high side. While depressant, everything is dull. While the extension is just calm, is nonchalant, is numb to pain. And some could be hallucinogenic. They're having strange experiences, hearing voices, on account of the psychoactive substances that they've had. Now, these are examples of when you see someone that has what we call depressants. These are things you should start considering. Could it be alcohol? Could it be benzodiazepine, like sleeping medications, like diazepine, like flunitrazepam, opioids? Just as I said, they are downers. We call them downers. Solvents, barbiturates, cannabis are low dose. Stimulants, when we look at stimulants, amphetamines, which layman or in the streets, it could be ice. When you hear people say ice, these are referring to those amphetamine, methamphetamine, cocaine, which it can come in various ways, which some inject, some chew, some swallow, some takes in various ways, some smoke it. Tobacco, which we call nicotine, cat, caffeine. Importantly for us to understand that energy drink as caffeine, has a high concentration of caffeine, and likewise, coffee also. So coffee can make people to be stimulated, and these are psychoactive substances. And MDMA, hallucinogenics are these that make people to have some strange experiences. They may start seeing things that others are not seeing. They may start hearing things that others are not hearing. Just to let us know that addiction is a journey, and likewise is recovery. People, from the first day they start, they don't get addicted, but over time the body get used to it, and before you know it, the drug take over that individual. So in this, we can say that it was the individual that welcomed drug, but after a while the drug will take over from that individual and will now be in charge. And that's more or less, we can say, is like the devil taking over such an individual. And that's maybe later on when we talk about the spiritual side of it, we'll have more understanding. But this is just an example of some quotes that I found online. Secondary school, they just got introduced to it, and before you know it, they can't do without it. This just to illustrate us the burden and the shackles that drug brings into life. And believe me, I've seen a lot that you really wish things could get better for such an individual. Relatives have tried, everybody has given up. They are getting tired, they're exhausted. Recently I had a father that was cursing the day that they gave birth to such individual because they were fed up. It's not just about the individual, it affects families, it affects communities. In Nigeria now, we're talking about a lot of issues about terrorism, banditry, but believe me, a lot of this goes with drug, armed robbery, illegal internet activities. A lot of them go with drugs. And now when we look at the burden, the expenses that goes into rehabilitation is quite enormous, which tell us that there is a lot that goes with addiction. And now when we're looking at addiction, is a complex issue, which we all know that nobody wants to talk about it. It comes with stigma, shame, and denial that more or less make it worse. Just as we always say, expose the devil and you have the victory. Shame the devil and you have the victory. But unfortunately, a lot has been ascribed to it. Yes, it could be understandable because nobody planned for it. It comes with denial. But I think it's important that we need to unravel this enemy, and we can start unraveling it by start talking about it, opening up conversation like OAD are doing today, which I give tribute to them for doing a good job when it comes to development of the youth and health of every individual, as the case may be. Now, looking at Nigeria as a case study, in 2016, a study was done which was published in 2017. It's obvious that the prevalence of addiction in Nigeria, or drug use generally, is quite on the high side. Now, drug use, we're talking about the number of people that use drug. And believe me, these statistics exclude tobacco and alcohol. And if you are in the news, recently government has been looking at banning sachet alcoholic drink, which I think is a good step in the right direction. However, about 14.3 million Nigerians between the age of 50 to 64 in 2016 were using drug, and that excludes tobacco and alcohol. And compared to global reports, about 5.6 globally. And that tells us that there is a lot of issues with drug problem in Nigeria. And we talk about 1 out of 5. That means out of these 40.3, 376,000 are high-risk drug users. And these include those that inject drugs. And the age is, when we say Nigeria has a productive age, we are talking about the 25 to 39. I think I need to rush, but I think we can have some of this slide later on. About 40%, importantly for us to know, we said about 1 to 4 of drug users are female. 1 to 4 of drug users are female, and that's quite surprising. But unfortunately, it is 1 out of 20 of these people that consider interventions. And that gives us a big concern as an expert, because the maternal health is a quite important part of mental health. These are just to let us have an overview. Now, what are the risk factors to addiction? Genetics contribute significantly to addiction. We say about 50 to 60% of heritability has been associated with drug use. Early age of initiation also tends towards addiction. Females are high risk. When a female use drugs, they have high tendency, we call it telescopy, of developing complications from drug use and likewise becoming addicted to it. Early childhood adversity. And I think for those that are focusing on prevention, I think this is quite important. We talk about adverse childhood experiences, and one of those 3 strategies that has been postulated to help to reduce this include ensuring that your child has stability. And when we talk about stability, we're saying that a child growing up should have a stable environment. It doesn't speak well that a child is changing parenting as such. And also safety. When we talk about safety, we're talking about let all effort be put in place to reduce verbal, physical, emotional, psychological abuse of children, including sexual abuse. And lastly, nurturing. Nurturing is also key to helping a child to grow up and to prevent them being at risk of addiction. Dysfunctional family, peer influence, poor coping skills, chronic illness, mental health condition, availability of drug, societal permissibility, and addiction role modeling. When a child sees father or sees someone that look up to using drugs, this could also contribute to addiction. And just as I said, mental health condition, depression, anxiety, and so many also make a lot of people get into drug use. Now, what are some misconceptions that some people have about addiction, which I think we should start reviewing? Addiction is a moral failure. No, addiction is not a moral failure. Yes, at the onset is a voluntary entry, and that's why as believer, that's why the Bible encourages us that don't give room for the devil. Don't give handle to the devil. Once you give handle to the devil, it find a way in, and once it gets in, it take over. So, but once somebody have addiction, which we are focusing on, that person need help. Yes, many of them want to stop, but they don't know what to do. They don't know how to stop. They've tried all effort. And even there are instances that some people end killing themselves, all because they don't know what to do. And there's a lot of assumption that addiction is not treatable. Addiction is treatable. However, we emphasize that it is not curable. Just like asthma, just like hypertension, just like diabetes. These are illnesses that, except divine intervention comes in, that they are something that an individual may need to live with, but is manageable. And what we mean by is manageable is that they can live with it and still achieve their goals in life. Just like people that put on glasses, if they remove their glasses, they may find it difficult to read. However, if they put on their glasses, they can drive, they can fly aeroplane, they can become all that they want. So addiction is manageable. You can manage it, you can overcome it, and you can move on with your life. Addiction doesn't include alcohol, tobacco, or cannabis use. In my practice, a lot of people will say, oh, I will stop this, but I think I can go on with tobacco. I think that's a misconception. Once you use one, it's like siblings. Just that one is like, we call them gateways to others. So it's the gateway, is an entry point to the bigger problem. So it's better you stop all. We advocate total abstinence as the end goal. It is only those that has hit the rock bottom that should seek treatment. No, it's not until when everything has crumbled down. Don't wait until everything has crumbled down before you seek for help. Seek for help at the earliest time. And we advocate that in a good setting, anybody that appears in the hospital should be asked about their drug use. Do you take alcohol? Do you smoke? Because these are good points to screen and to educate them. And there are various interventions that doesn't need intensive intervention. That's just counseling. We do a lot of help, and we help that person to get back on their feet without addiction. Some assume that addiction treatment is not lifelong, that if you can stop there, you can live as usual. No, once you have addiction, once we make a diagnosis of addiction, we encourage you that you need to be on the guard. You don't need to give room for the devil. Don't allow the old ways to come back again. So is it something that you need to fight all through your life? But the more you fight it, the more you master it, and the more you know the tricks that the devil may want to bring along the line. Once you stop using, you have recovered. No, stopping using is not the end point. We advise that recovery entails that, just like we say health is you be able to function effectively, you'll be able to achieve your goals and dreams and aspirations. So that is the point of recovery. So if you are using drug and now you stop, I want to encourage you that you should move to recovery, which entails that you should get back your dreams. And that's why spirituality also comes in. It helps to sharpen your vision, helps you to understand your destiny. And by so doing, you're able to live a fulfilled life. So the emphasis is not just stopping drugs, but gaining back your life and fulfilling your dreams and aspirations. Relapse episode means that treatment has failed. No, people oftentimes they may relapse. Just like a little child, when he starts growing, it may fall. But he shouldn't just now sit down because he fell down. He should rise up and continue. I hope I still have some time. Moderator. All right. So now these are just definitions for some of us that might clinically inclined. We can look at this. Then problems associated with addiction. Addiction comes with a lot of problems, which from intoxication, a lot of accident, road traffic accident are on account of addiction, poisoning, absenteeism from work, and so many others. Why do people get into drugs? One of those things that make people get into drugs is they want to numb pain. They want to, maybe they are going through some challenging times, emotional disturbance. They want to feel relief, and they want to forget all their trouble. And that's why some started using drugs in an effort to forget about their trouble. Some, because of they want to function. And believe me, a lot of people that are into illegal internet activities that have come across, because they will have to be awake, they want to be focused and alert, they start using drugs for a purpose. No, I've seen a lot of people, newscasters, that they started using drugs because of fear of facing the crowd. Some for pleasure, they just want to enjoy. Some, as I said, psychiatric disorder because of their depression, they have anxiety. However, some, because they are feel socially disadvantaged, and just to feel among, they start using drug. And as we know, peer influence, and also some just want to explore, they want to experiment. Now, concerning youth, we categorize the youth to 3 categories. Some are risk takers. They are looking for, and they also fall into the pleasure seeking. They just want to, they're adventurous, and they just want to have a feel of how it is. And from there, they got hooked. Some are socially disconnected, and there's a set of people that peer influence are the reason why they get into it. And some is by virtue of they want to self-medicate themselves. So peradventure, if you are any of these are warning signs that you need to watch out. If you are someone that you are easily influenced, then you need to be careful of those that you move around with, so that they will not negatively influence you. When people first try drugs, it is usually a voluntary decision, but after the using the drug for a while, it's no longer voluntary. So I want us to have this at the back of our mind. As much as we want to help those that use drugs, we need to have this at the back. Initially, yes, it's voluntary, but as they move on, it may become non-voluntary. So how do we prevent drug use generally? We all know that it comes with negative consequences, but studies have shown that it can be prevented. And that's why in the developed country, a lot of resources are put into strengthening family, school, healthcare systems, so that prevention strategies can be channeled along these routes. And just as I said, one of the strategies that has been found to be very effective is preventing adverse child experiences. And just as emphasis again, I say safety for our child. A child should be safe. A child should live in a stable environment, and a child should receive good nurturing. And likewise, those at risk, those that are positive family history of substance use, these are what we call at-risk group. They can also be provided some specific selective, we call selective intervention. You select them and you provide intervention to help them to stay off drugs. Now, when people have addiction, the first step we advocate when it comes to drug addiction is, we do medical detoxifications, which comes with, getting the drugs out of their system. They may need to live in rehab or outpatient, as the case may be. And these are various ways of providing intervention. It could be inpatient rehabilitation, it could be residential rehabilitation, and thereafter they move to the aftercare programs. These are also for academic purpose, for those that are interested in academic. These also are more or less academic purpose, but these are programs that we offer. As a specialist in terms of managing people with addiction, we provide psychosocial intervention. We start from community or day programs. And believe me, these are opportunities for us also to be enlightened about avenues that we can give. You can design a day that, okay, for screening and brief intervention, for psychological intervention, you want to build some life skill training for those that have poor social skills, so that they can be strengthened. For some cases, because am I audible? All right, thank you so much. So we have pharmacological intervention also, and we have this we call substitution maintenance program, antagonist pharmacotherapy. We have harm reduction, which is quite common in developed country, in US, because of the pandemic of opioid. Now, spiritual dimension, the Bible provides insight. We have the privilege that being a believer, being a believer, we can also take advantage of our spiritual heritage. The Bible provides insight into the concept of addiction through its emphasis on self-control and moderation. So, addiction is something, nowadays we are even looking at food addiction, so many forms of addiction. And that's why the Bible, if you look at New Testament, talk a lot about self-control, moderation in all we do. If you look at the book of Proverbs, also it's warned against overindulgence. Proverbs 23, talk a lot about more or less like a picture of someone that gets addicted. And studies have shown that spiritual well-being helps in recovery. And that is one of those things that we should encourage anyone that have addiction problem, that getting into building up their spiritual life will go a long way in their recovery. These are examples of some biblical illustration that talk about people having addiction. So now when we look at features of spirit, you have somebody say talking? Okay, should I round up? Oh, all right, I will quickly I should round up. Okay, so there's a slide that talks about how spirituality and substance are related and the benefits of spirituality in recovery. And studies have shown that when people are more spiritual, the ash here you can see is on the high side, and specifically attending service has been found to help recovery. This is a program that we make use of, and that's one thing about mental health. Mental health believe is spiritual therapy, and these are one of those things that we emphasize: admitting to God, to ourselves, and to another being the exact nature of our wrong, and so many things. So in conclusion, addiction is a menace that affects every aspect of life negatively. Even though it's manageable and preventable, it's ravaging and destroying promising future and destiny of many. Spirituality and life of faith, according to God's principle, has been proven to help people with addiction to recover. Thank you. And these are books that I will recommend: Breaking Bad Habits, Structuring Your Life for Responsibility. I use majorly most of this in my rehabilitation program for those that are going through recovery. And I want to thank the moderator and also the CEO and our chairman and founder for this privilege to have this presentation. Thank you once again. And I want to hand over.
Thank you so much, sir, for this insightful presentation. Just like Dr. Ayankola mentioned earlier, please, if you have questions, please pen them down, and at the appropriate time, your questions will be attended to. Now we are going to be inviting our founder and our father, Reverend Olushola Ayodele Areogun, for a very brief ministration. Over to you, IT.
The world, when coronavirus first came, even presidents of countries were talking that people should pray. But it wasn't from their heart, it was from their fear. Because they didn't know what was going to happen. But as soon as the world made vaccine that worked, they began to shift away from God. Are you follow what I'm saying? Now they are talking, okay, there's another virus that they don't know whether vaccine is going to work. What is going to happen next year? Supposing a super virus come that nothing is going to work against, what's going to happen? The world is going to go into another lockdown. But you and I must not go into a lockdown, because vaccine or no vaccine, we know what works. Because most of the things, the weapons that make you to win in life, you have not identified them. A lot of you are a house of working weapons that you are neglecting in the battles of life. So God does this. Are you following me? Because I'm going to get after this now. God allows you to be tested in things to show you what works. Get your faith working. When headache come, use your faith. You say, excuse me, I applied faith. I tried faith. First day, second day. One sister says, excuse me, by the third day, I couldn't go. I said, you tried. 3 days, you stood. That is great. Let me ask you one question. How many of you have read the report that even WHO experts are talking about the vaccine? Strangely, they say one vaccine causes blood clot, this one does this, and I read the report. I said that the overwhelming benefit of what the vaccine will do outweigh this insignificant risk that people should still go ahead and take it. They didn't cast away the vaccine. They said no, vaccine is 100% sure. And yet they encourage people to go for that. Why do you throw out your faith? Are you following what I'm saying? You are going, you see, you are driving to the hospital to deliver a baby, and they are carrying a corpse out. Hey! They are there here. You turn back. Was that what you did? No, you went inside. Are you listening to me? If men give what they know is not perfect chance to work, give what God knows cannot fail chance to work. The scriptures cannot be broken. The power of God cannot fail. Are you following what I'm saying? It is in the scripture alone that you find with God all things are possible.
We are welcome back. And now, before we move to our panel discussion, we're going to be introducing our panelists. And afterwards, we're going to be moving straight into the theme for today. So first, I would like to introduce pharmacist Temitope Adesoya. Pharmacist Temitope Adesoya is a Canadian clinical pharmacist with experience in hospital, community, and long-term care practice. She obtained a Bachelor of Pharmacy degree in University of Lagos and a master's degree in clinical pharmacy, international practice, and policy in University College London. She is also the creator of the Healthcare Career Opportunities and Education YouTube platform called Healthcare with Temi. On her channel, she shares practical, evidence-based content on health and wellness to support and empower the public. She is committed to advancing healthcare awareness and improving patient outcome through both clinical practice and public education.
So pharmacist Adesina Timileyin is a dedicated pharmacist with over 11 years of experience in community practice. She is currently the chief superintendent pharmacist for Tonian Pharmacy Limited, one of the top chain pharmacies in FCT Nigeria. She holds a Bachelor of Pharmacy degree from Obafemi Awolowo University, OAU Ile-Ife, and she's currently rounding off her master degree program in public health. She is passionate about health education and has successfully collaborated with healthcare organizations at different opportunities to equip the community with knowledge for informed health choices.
Moving on, we have Dr. Mrs. Tosin Omonijo. She is a senior registrar in the Department of Psychiatry at Uniosun Teaching Hospital, Osogbo, Osun State, Nigeria. She's a passionate advocate for mental health and wellness and actively promotes campaigns aimed at reducing stigma towards individuals living with mental disorders. She has participated in numerous public enlightenment programs targeting women, adolescents, elites, and various professional groups, educating them on the danger of psychoactive substance use and the importance of maintaining sound mental health. Our approach to care is deeply influenced by our Christian values, which she uses as a guiding foundation in supporting and uplifting others. Dr. Tosin Omonijo is happily married and blessed with 3 children. You're welcome, man.
All right.
So Ayankola Ayantunde is our keynote discussion, the panel discussion. Yes. You're welcome, Stars and Maths.
Okay.
Okay. Now we are going to be moving now to the panel discussion. Our topic is Breaking the Silence, Understanding the Silent Epidemic, Unveiling Hidden Truths about Drug Addiction. And our first question is actually going to go to our keynote speaker, Dr. Tunde Ayankola. And the question is this, what is drug addiction and the common types of drug addiction you have seen? Actually, you've already talked about that in your presentation. Perhaps you have something more, I mean, a keyword you want to share on this briefly. Over to you, sir.
All right, thank you so much. Yes, when we talk about addiction, just as I said, we describe addiction, we talk about it being primary, that is the dysfunction when it comes to the outcome to life. You know, when something an individual, something that an individual is taking is affecting is whether it's psychological well-being or physical well-being or social well-being, or it becoming a legal issues, and that person find difficult to stop using, then we start thinking that that person has addiction. And I use this just for us to always remember the forces of addiction. When an individual has craving, when he has this irresistible urge to use substance, that no matter what is happening, he has irresistible urge to use. That's one of the C's of addictions. Or the individual has compulsion to use. There is just this push, just this pressure to use. He can't say no to it. That is also one of those things that comes with addiction. Or there's loss of control. He uses anywhere, anyhow, in any moment. That also is a pointer to addiction. Or when, despite that is having negative consequences, he persists to use, then that person has addiction. So once any of these has been identified, then we assume that that person has addiction. That's for layman language. But for us as a specialist, we look at other things where you use some technical terms, which I don't think we need to bother ourselves with. But just bear this in mind, the forces of addiction. 1, craving, compulsion to use, loss of control, and negative consequences. Craving, compulsion to use, loss of control, negative consequences. So peradventure, if you are out there and you are having any of this, you have this irresistible urge to use, you can't just say no to it. It's like there's a pressure within you just to use. Despite all advices, all discussion, your dad, your mom has enlightened you, has discussed with you, you should stop, but you just have to. That tells us that maybe you have addiction. So I would like to stop here.
So the next question will be directed to Dr. Tosin Omonijo. Yeah, yes, ma'am. Medically, what happens in the brain of someone who becomes addicted, and what are the symptoms of this addiction? Yes, ma'am, you're welcome.
Okay, thank you so much, moderator. And I want to first appreciate our founder and the CEOs, my father, mother in the Lord, for this great opportunity to be part of this program. And this is a wonderful program. It's highly happy about this topic because substance use is becoming a global pandemic. And I'm happy that this program will help a lot of people to enlighten and to give insight into this. So back into the main context of the question, what happens in the brain of someone who is addicted? Now, every activity of the human body is controlled by the brain. And there is something that God has put in our brain. And there's a part of the brain we call the brain reward system. Okay, this system is essential for our survival, is essential for our living, and that is like the core of addiction. When we're talking about what happens in neurobiology, what happens in addiction, that's the brain reward system is the culprit, the core of it. And what happens is that for every pleasurable activity we engage in, like food, and which is essential, for our survival and eating, and also for reproduction, sex. I don't plan to be vulgar, okay, but those are essential behaviors that are, for our living. These are pleasurable activities we do, okay, which also is influenced by appetite. Somebody is hungry, There's a center in the brain called the appetite centers that are stimulated. And then when we engage in the activity of perhaps, for instance, eating now, there's a pleasure, there's a satisfying, there is a part of the brain that gets satisfied, that informs you that, okay, now that need has been met, I'm full. So that also comes to play in substance use or in addiction. So now when the brain reward system, what happens when pleasurable activities happen, like when somebody takes a substance, there are neurotransmitters, or I call it neurochemicals in the brain, that are released. And there's the principal one I'll talk about is dopamine. So there is an high increase of dopamine that is released, okay, in some parts of the brain. And to be more specific, dopamine is released in some neurons in the brain that is released in a pathway that connects the ventral tegmental area to the nucleus accumbens, okay? And when that is released in what we call the mesolimbic pathway, now what happens is that there is an amount of euphoria the person experiences when there is that surge of dopamine. But normally, when we do activities like eating, there's just a normal release of this dopamine, and there is that satisfying reward, that satisfying experience that we have. But when someone takes a psychoactive substance, like a stimulant, for instance, Dr. Nicola gave us some examples of some. If somebody takes just like a puff of cocaine, what happens is that person has a very high release, a high surge of dopamine release. That neurotransmitter is released about 1,000-fold. 1,000-fold. So that brings about an euphoric effect. And now the euphoric effect the person has is like, just you winning a jackpot all of a sudden. You feel very, very, very happy. You feel very euphoric. And that euphoric feeling, when the person experiences that euphoric feeling, the normal satisfying experience now becomes, not satisfying anymore. So that brings about what we call a repetitive behavior of, okay, I want to have this, I want to sustain this feeling again. So the person takes that substance again to have that surge, to have that effect, to have that feeling. Now the brain goes into what we call neuroadaptation. God has put measures in us, to help regulate, because now we have more than enough neurochemical of dopamine that has been released in the brain. So the brain is trying to measure up. Normally it's been maybe 10%, but now you're having about 200% being released. So the brain looks for a way to adapt to that. And now when the person keeps on doing that behavior of taking the substance again, the brain has to modulate how to deal with 200% now of that same neurotransmitter. So the brain undergoes neuroadaptive measures by reducing might alter the receptors that this neurotransmitter or this neurosubstance binds to exact its effect. And when that neuroadaptation occurs, that quantity of the substance that the person is taking, maybe alcohol, maybe cocaine now, the person takes that same substance but does not feel that effect anymore because the brain has adapted to that. And so to have that and chase that first feeling, the person has to increase the number of substances taken again. And we call that tolerance, because at that stage, the normal dose the person is taking no longer has the desired effect. So a person now has to take a higher dose, maybe increasing now from 200% now to 400%. And then the brain also continues to neuroadapt. So it gets to a point that when the concentration of that substance is reduced in the body system, is reduced in the brain, because over time the brain has learned to adapt to that. Okay, when the concentration of the substance is now reduced, the brain now begins to struggle to function because it is already used to operating at that level. So at that point, the person now begins to have some unwanted effects. We call that withdrawal symptoms, which are very are very distressing and very unpleasant feelings that the person has, depending on the substance the person is taking. However, when the substance is now introduced, those symptoms just melt away and just disappear like that. Also, there is a part in the brain that is responsible. That's the prefrontal cortex. Okay, is responsible for our planning, our judgment, our decision making, and things like that. So that aspect also, that part of the brain is depending on the substance that's being taken. When substances are being taken, it inhibits that aspect of the brain, and that is why you find people that are under the influence of substances. They just misbehave. They act in ways that you wonder what is happening. Their judgments are impaired and things like that because there's an inhibition of that prefrontal cortex. And also, there is also this there are also some other parts of the brain, like the amygdala, like the hippocampus. Those areas are responsible for memory. Now it gets to a point in time that this behavior, now the brain begins to learn it, from the usual behavior. So that is stored in the brain, is encoded. That behavior is encoded and stored in those areas in the brain, such that even when the person abstains for a while, and the person sees, maybe somebody smoking or somebody drinking, what we call cues, they're exposed to this substance using behavior. It creates an intense surge. The brain, because it has thought that, the brain begins to like, oh, I want this, I want this, I want this, I want this. It remembers the feeling, the high euphoric feeling I'm doing. That results in what we call intense craving. And some have relapsed even after some time of abstinence, and then they have gone back into taking that substance. They have gone back into taking the substances. So these are the changes that actually happen in the brain. And over time, sometimes when people, abstain, either due to the withdrawal symptoms, they find out that they have to take the substance again. And sometimes after a period of abstinence, they have to. Thank you so much. Okay, thank you. Thank you, sir.
All right, we are grateful. Thank you so much, Ma. So the next question will be directed to pharmacist Timileyin Adesina. The question is, are there some personalities or genetic profiles more vulnerable to addiction, or can anyone become addicted, and why? So you're welcome, Ma.
that. Thank you so much. And now we're moving to pharmacist Temitope Adesanya. Please, ma'am, what are the most common medications used that can be abused today, especially among the youths and working adults?
Thank you so much. I'd like to appreciate this privilege given to me to be on this platform today. Thank you so much, Daddy and Mommy. I really appreciate it. And thank you to the OAAD team. So I'll be talking, thank you so much for that question. And I want to appreciate our keynote speaker. And I also appreciate Dr. Monijo because it makes my answer to this question easier to understand. Thank you, sir and ma. So I'll be talking about prescription drugs that are commonly abused among youths and the working class today. And our keynote speaker already addressed the definition of prescription drugs. Those are medications that require a prescription from a prescriber, from a doctor, for you to be able to get. So the most common one, as we can imagine, would be the opioid pain medications. And Dr. Omonijo already, that was the first thing she talked about when she talked about, when she discussed what happens in the brain with addiction. And these drugs, this group of drugs are strong medications that are used to treat moderate to severe pain. And the reason why they carry such a high addiction risk is because they activate the reward pathways in the brain. And Dr. Monijo already took us through what happens in that process. So that's why you see this group of drugs commonly addicted to. So we have examples like, we have things like hydromorphone, pentazocine, tramadol, fentanyl, morphine, and things like that. These group of medications are things you will commonly see when people go through a surgery, when people have like major accidents, and in cases of really severe pain, or even in some people that are treating severe pain in things like cancer treatment. And that is the major reason why they have such a high addiction risk, because of the way they work in our brains to manage pain. Another group of drugs, prescription drugs that carry a high addiction risk or commonly abused among youths, would also be benzodiazepines. So benzodiazepines, in basic language, I would say that these are a group of drugs that are commonly used in conditions such as treating panic disorders, treating anxiety disorders, treating insomnia. That is when somebody is having issues with sleep, difficulty falling asleep or staying asleep. The peculiar thing with this group of medications, because of their dependence risk and addiction risk, it is usually advisable for them to be used for a short period of time. So when it is being used for longer period of time, we start to see increased risk of addiction. And so they cause, majorly, they cause a lot of physical dependence. And when we talk about when a person has been using this for such a long period of time, abrupt withdrawal of such medications could also lead to some side effects, some withdrawal side effects, especially seizures. So it's very peculiar to note that with this group of drugs, examples are things like diazepam, which we commonly know as Valium. Examples are things like Ativan. Examples are things like bromazepam. These are the common benzodiazepines that are commonly used. So it's very important that we understand that these drugs are supposed to be used only short term and not for long-term use. Another group of prescription drugs would be the stimulants. These drugs, when they work in the brain, they help in increasing dopamine levels. And Dr. Monijo already explained how that works. Those are like your happy hormones. And if you are not careful, if a person that is prone to getting addicted to a medication is using this group of drugs, the person might become dependent on that feeling. We already went through what happens in the brain with the dopamine levels, with increased dopamine levels. So you see stimulants, medications, and medications that are used in people that need increased focus, increased concentration. So we see medications like Vyvanse or Ritalin or Concerta. People that have conditions like attention deficient hyperactivity disorder, people that have difficulty in focusing and concentrating, are people that use these drugs. And so we see people getting addicted to that feeling of wanting that energy, of wanting that level of energy, or wanting that level of focus. And some people even abuse it because of the side effects that it has of decreased appetite, leading to weight loss in some people. So some people abuse it and get addicted to it, especially those that have eating disorders, get addicted to it because of that side effect. Another group of drugs, prescription drugs, that carry a high addiction risk would also be sedatives. So these are what I would call sleep medicines, if we want to put a basic term to it. So sedative, hypnotics, the ones that have the licensed indications for these conditions are, they call them the Z drugs. So things like Zolpidem, Zopiclone. And it goes without saying that these drugs, because they give you that sedative effect, they help you in falling asleep, they help you in staying asleep. And so some people get addicted to that effect of just being numb to whatever is going on around them. They just like that, and some people get addicted to it that they cannot even sleep without taking a sedative drug. So that is another group of prescription medication that carries a high risk of addiction. And then the last one that I will mention would be some muscle relaxants. Not all muscle relaxants, but some muscle relaxants we are finding more recently people are getting addicted to, just because they have the side effect of sedation, in some cases extreme sedation. An example could be cyclobenzaprine. That's an example of a muscle relaxant that also carries an high addiction risk. And when we look at the youths and the working class, someone says, oh, I pulled a muscle, or I was carrying something heavy and then I had a muscle spasm, and then they had to take a muscle relaxant, and then they start to enjoy the effects that gives them. That could also carry an addiction risk to it. So those are some of the major prescription medications that do have an addiction risk among the youths and the working class today. Thank you.
Thank you so much, Ma. This question goes to Dr. Tosin Omonijo. And dwelling on what Dr. Temitope already said, that, pharmacist Temitope, I beg your pardon, already mentioned that these drugs should be used just for a short period of time. Now, when people use them, when they abuse them in the long term, what happens to such an individual, like physically or mentally? Dr. Tosin Omonijo. Thank you.
Okay, thank you so much for that. And that was a great one from pharmacist Adesoya. Yes, the long-term complications or implications of the substances, it cuts across different aspects. I'll just group it this way on the psychology or the mental complications. And then we also have the biological complications and social complications of long-term use of the substances. Remember, not just the medications, but we're also looking at psychoactive substances in all, generally as a whole. So physically, I'll first talk about the biological complications. They actually affect all organs. There is hardly no organ in the body that is not affected. The primary center that is really, really influencing the use of the substance is the brain. And the brain is the citadel of everything we do as a human being. So once the brain is affected, just bear in mind that any organ in the body can be affected. You understand? So depending on the substance used, you can have some affectation in the brain. You could have different diseases coming up as a result of this in the long term. Also in the short term, people can be psychologically, you could have intoxication. People can be intoxicated, which will impair their judgment, will impair their planning, how they plan, how they perform executive functions, their language, speech, and things like that. That could be affected. Also, we could have conditions like Wernicke-Korsakoff's encephalopathy that occurs, especially in the case of alcohol misuse. You understand? And then that's just talking about that's intoxication. People can also, in the long term, come down with full-blown psychosis. They can come down with psychosis. They can come down with problems with memory problems, amnestic syndromes, and the likes. They can come down with that. They can also have withdrawal states. They could also come down with coma. Excuse me. And come down with coma. depending on the substance that is being used, and things like that. So then psychologically they can become dependent, and that's like, drug. That's the addiction we're talking about. And this is a real serious problem that can affect virtually other aspects of the human behavior. Now let's talk about socially. Can affect the person's, even the person's personal care before I even go socially. Still talking physically, the person's personal care, because their judgment is now impaired. The focus is now on the substance use, especially when they are dependent. So there is reduced personal care. They no longer take care of themselves and they are grooming. And that also could lead to a number of complications biologically, physically. They could, come down with infections, because it also affects the way they go about they eat. They could have nutritional deficiencies because they're not eating properly. Instead, they are consuming the substance. Okay, so they could come down with a lot of nutritional deficiencies. They could be their immune system is low. They are susceptible to any form of infections at all. You can imagine. And then coming socially now, their interactions. How do they interact with their spouse? Somebody is highly dependent, no longer interacts well with their spouses, no longer interacts well with their children if they're married. Okay, and then there's this they are socially isolated. They are withdrawn. Okay, they no longer go to work. You understand? They no longer function effectively, if at all, even they go to work. They are as well just counting attendance. They are no longer that effective, that functional at work. And also mentally, they could come down with mood problems. They could have depression. They could start having anxiety disorders. I've talked about psychosis. And over a long run, the long-term complications are so many. So many. But I'll just put a pause at that. Thank you.
So much, Ma. We are grateful. We can see from the point that she mentioned that whatever affects your brain can affect other parts of your organ. So thank you so much, Ma. So we're going to be moving on to Dr. Ayankola. So Dr. Ayankola, the question is, can drug addiction lead to psychiatric emergencies? And what are the red flag symptoms that indicate a psychiatric emergency that need attention in an addicted person? Dr. Ayankola.
All right, thank you so much for asking that question, because a lot of people present at the point of emergencies, which I think these are some of those misconceptions that we need to work on. We shouldn't wait until it gets to an emergency. So let everybody, if you have someone close by, don't let it wait until it start disrupting the environment, it start threatening to kill, or the person has refused to eat, or he stripped himself naked. So please don't let us wait until that before we make them to present. Once we have features that suggest that this person, there's change in the milieu, which I'll talk about, everybody knows how individuals behave. Once you notice there's a change in the attitude, in the way the individual is feeling, the way he's looking at life, or maybe he's functioning, things are not going the right way. I mean, one of those things that should be screened is substance use. So I want us to work hard on prevention as much as possible. Now, concerning emergency, yes, just as Dr. Monijo has said, some of them can come down with frank psychosis. They may start hearing voices. They might start seeing things others could not see. They may refuse to eat. They may start someone that really look up to the parents. They may become irritable. They may get angry without or with minimal provocation. They may start having some strange belief. Some may start saying that they are special. They have some special power. They can do so many things. Some may start having poor sleep. Some may become restless. So it can vary. But I mean, just as I said, once you notice any strange in behavior, please let such individual present for assessment. And one of those things that should be assessed is drug. We should try and find out any positive history of substance use, which can screen. There are instruments that can check the urine. There are instruments that can check other things to know whether somebody has been using drug or not. So those are the things that can be a red flag. to somebody that is using drug. Someone that is doing well in school, suddenly you notice that is no longer doing well. Someone that used to call you frequently no longer is calling. And that once you notice things are not going in the right direction, don't overlook it. Don't assume, he's brought up in a Christian home. I trust him. He has always been good. Believe me, we need to have this at the back of our mind that drug is everywhere. And it just needs the first use is the most dangerous part of it. Once the first use is welcome, we don't know who can get addicted. So once you notice any changes, and also you should check your wants, check those close to you. Maybe you see some what we call paraphernalia, you see leftover cigarettes, you see lighters, you see matches, or you perceive odors. Please don't overlook this. These warning signs. This could be avenue for us to intervene on time. And importantly, we say that peradventure, if you have anyone that has or you suspect that is using, don't let us be too hard on them, because just as we know, we say it's a silent epidemic. Everybody wants to cover up. Even those that use, they want to cover up until it gets out of hand. Almost everybody at the onset, they want to cover up. So we need to be not tolerating, but we should help them that they can open up, that they can discuss openly with us their struggle, their challenges, the kind of friends they are having, the kind of pain they are having, the struggle they are having, their various life. So I think those are things that we should watch out for. Once you notice change in behavior, you notice that somebody that used to relate better is no longer relating. You see paraphernalia, you see leftover of cigarettes or tobacco, you perceive odors, or you notice that this person is keeping to himself. Please don't overlook it. However, if you now see that his eye is red, is misbehaving, is restless, is becoming irritable, is having hallucinatory experience, or you have a delusional experience, then I think we should encourage that person to go for evaluation. I don't know if I'll be able to answer that question. Sorry, I've answered the question. Oh, I was muted. Was I muted?
No, sir. No, sir. We can hear you clearly. Thank you so much, sir.
All right, thank you.
Okay, sir. Now I would like to call Pharmacist Additional. Please, as a pharmacist, what are the over-the-counter drugs that are abused but easily overlooked, ma'am? Yes, yes, ma. Thank you so much, ma. Thank you very much. Just like she mentioned, please do not stigmatize, just educate them when you meet anyone like that. This next question is very, very important, especially for parents who have teenagers or young adults in their vicinity, or they have them as children. Also, if you also have anyone around you, you don't necessarily need to be a parent. You can also observe this among any teenager in your vicinity. So, and this question is directed towards Dr. Ayankola. Please, sir, how can parents identify when a teenager is experimenting with substances? What are the trigger signs to look out for when they do? Thank you, sir.
All right. Thank you so much. Sorry, I muted my mic. Oh, can you hear me now? All right. Thank you so much. Yes, it's a journey, and the journey starts with the first years. But prior to that, I think we should also be enlightened about preventions that will help a child not to be enticed to using drug. And as emphasis, I've talked about the adverse child experiences, because studies have shown that this contributes significantly to later on in life using drugs. And that is very important that a child grow up in a safe environment. Safe environment will help a child not to be traumatized, because a lot of people are traumatized, and because of that, they have inferiority complex, which made friends to influence them negatively. And also, it's also important that a child grow up in a stable environment, stable home, not the environment whereby he spends some weeks with somebody, another week somewhere else, another month somewhere else. So these are very important, and also nurturing. And that's why it's if all these three are emphasized and are work on, the risk of a child, because many of these teenagers know that drug use has consequences. But however, because of the peer influence, because of the poor supervision that they are having, it makes them to be prone to start experimenting. Now, when they start experimenting, there are some flags that you start noticing. Once you notice that someone that used to listen to you, then now is no longer listening to you. Yes, there might be some teenagers trying to create identity for themselves. But beyond that, when you see someone that find difficult to look to you eye to eye, but now he's coming late home, he's hanging out with some questionable friends, and you perceive that there has been a significant change in his behavior, then this call for attention that you should start suspecting and start evaluating probably is using psychoactive substance. And it could now get worse to the point that maybe physically you find that it's restless, it's sweating, because there are some withdrawal symptoms that come with it. Once they are addicted, if they don't have it, there are some withdrawal symptoms that come with it. Now, depending on the kind of substances that they are using, which I don't think we can exhaust if we start talking by each of them. But once you notice that he starts sweating, he starts panting, he starts becoming restless, his eyes is becoming red, things that give attention to is no longer giving attention to it, this is a red flag. And once you notice this, I think it's good that such an individual go for counseling, or even the caregiver. The caregiver may reach out to a psychiatrist or addiction expert or a therapist so that they can enlighten them more about what to do. But as emphasis, I think we should work on prevention as much as possible. And likewise, we talk about family dysfunction. These also contribute to it, and which spill over to unstable childhood. So I don't know if I'll be able to answer that question.
Yes, thank you so much, sir. Grateful for that. So our parents should take note of that valid point, that we should create a stable and safe environment for the children. So thank you so much, sir. So the next question will be going to Dr. Tosin Omonija. So, and it's the two questions that I'll be asking at the same time. So the first question is building on that point that Dr. Ayankola just helped us to mention. So what are the early interventions that can prevent a full-blown addiction? What does professional detox or rehabilitation really involve? And the second question, are there any chronic diseases linked to drug addiction, and what are they? Thank you, ma'am.
All right. Thank you very much, sir, for that. Okay, I will answer the first question. Okay, what are the early interventions? Okay, like just like Dr. Ayankola just said, there are telltale signs that we should begin to suspect, when we that we should look out for. So I would say the first thing is education, psychoeducation and awareness, which is part of what we are doing now, educating the public about substance use, its dangers, and how it can lead to addiction, things like that. So when we do more public awareness, we do more psychoeducation, educating people more. People are more aware of these things, and then another major thing about early intervention is looking and identifying the risk factors. What are the risk factors that, make people go into taking substances? And like there are some common risk factors. For instance, in my own little experiences, I discovered that many actually go into substance use due to peer influence. So we must teach our teenagers, teach our people how to, be assertive on what they want. First, educating them, about the dangers of this. I know, just like Dr. Ayankola said, I also used to tell my clients that the first use is that's like the main thing. So it's better not to even go into it at all. I advocate abstinence. It's better not to go into it at all, because once you go into it, afterwards you cannot determine what is going to happen. So we need to stress that and educate people more about that. And then our teens must pay closer attention to them. And you don't have to belong. You don't have to do this, to halt you. And when they know the implication of what they're doing, they're likely to have, a better understanding and be able to say no. And then assertive therapy, telling them you must be able to stand by your decision not to use this, no matter how much pressure you are faced with. I think that will go a long way in helping. Also, there are also some other risk factors, okay? Some people, it might be that they have a lot of emotional stress around, maybe sudden loss of job or, marital conflicts, and they just financial problems, financial constraints, and because of that, business is not going as well, or some catastrophic events just happened, loss of job, loss of house and fire, or some disasters happen and they're just back to zero. That's a huge blow on them. So how do they deal with it? Some people just go into substance and like, okay, let me go and drink away my problems. Let me just take this to just take away my. So we need to educate and teach people, okay, that those are unhealthy coping habits that could lead to problem, and will not even could lead to a lifelong problem. So there are other coping strategies. So we must teach people healthy coping styles. And some of these healthy coping styles are, ventilation, even just talking about the problem, not bottling it up. We go a long way in helping and relieving the person of whatever psychological stress the person is going through. You need to get somebody trusted to talk about this, okay? That helps in relieving, the stress. Physical exercises, those are also ways you can, help relieve yourself of some emotional stress that are bottling you up. Physical exercises have shown to really, really help with that. And then having a positive appraisal of things, whatever, there is a silver lining behind the cloud. There is always and so Yoruba says that we must try to look at the physical, the positive side of that negative event, and dwelling on that positive side will really help. Also, not to live in denial, not to overlook the problem, but going again and looking at, problem solving skills. How can I solve this problem? Is better than going and avoiding the problem and drinking away the problem. So I will pause at that. And now moving to the chronic detoxification. Okay. Yes, for people depending on the substances, there's some other programs that we can do. Dr. Ekola talked about that when he was delivering the keynote speech. Talked about different programs that we can do depending on the level of this substance use. There are screening tools that can be used and applied, to help assess people. And these are some of the early interventions we can do. Okay, and then we can classify, okay, this person is just mild use, this is moderate use, this is severe use, and then administer appropriate intervention, psychological intervention, counseling goes a long way, and different, so many other psychological interventions. So you can see a psychologist or a psychiatrist, and they will really help out with that. Then I'm talking about chronic diseases that are linked to this. Wow, I mentioned earlier that there is virtually no aspect of the brain that cannot be affected in the long term. And okay, let me talk a little about the detoxification process. Most times when we do this detoxification process, depending on the substance that we are dealing with or the substances, that's what informs the detoxification process. Usually it's done under the guidance of a well-trained expert, either the psychiatrists, okay? And then they are given, this is just done to help, deal with the unwanted effects of withdrawal, which could be life-threatening. Like Pharmacist Adesanya mentioned, in the case of opioids, patients could have seizures. They could have seizures. Some could go into arrhythmias and have cardiac arrest. So this, for such people that are highly dependent now on it, stopping the medication on their own could be catastrophic, could be disastrous, because they could go into very lethal withdrawal symptoms that are life-threatening. So it's better to see an expert, you see a psychiatrist, and then you are detoxified, on admission within the hospital, okay, so that those effects are properly handled if at all they happen. So I think I will want to put a pause on that. I don't know if I've done justice to all the questions in one.
Drug addiction.
Okay. Yes, thank you so much. Just in addition to what and to build on this, and Dr. Omonijo mentioned that interventions, and believe me, it's not just the individual that needs to receive intervention. The family members, we call them concerned significant others, also need intervention because they go through a lot, and the burden of taking care of those with addiction is quite enormous. And also, spiritual therapy is also part of those things that I emphasize in helping them to rediscover themselves, to re-identify themselves, and to be able to build the right image of who they are. So all these work in hand, and we emphasize multi-dimensional interventions, that so many things can go hand in hand for them to recover. Now, concerning the root cause, if I'm getting you right, man, you're asking about the root cause, spiritual dimension to root cause of addiction. Yes. If we are to look at it, when God created man, he created us. After creating man, he said, this is very good. But unfortunately, when Adam fell, so many things were lost. Man lost control, man lost so many things, and man began to chase after pleasure, rather than principle of God, what God expects, responsibility, and the rest, which could have given pleasure in the long run, but rather, and which happens a lot with the teenagers nowadays, they are chasing pleasure before responsibility, rather than responsibility before pleasure. And that's where things get muddled up, and they end up having things that they cannot handle. So if we are to look at it, after Adam fell, man became entrapped And this also reflects even in John chapter 10, verse 10, whereby the Bible makes us understand the thief comes to steal, to kill, and to destroy, which typifies addiction. Addiction comes to steal, kill, and destroy. And so if there's anything that can give life, is Christ. And all this we're talking about, safety, stability, nurturing, all these, following the Bible, all this has been incorporated. Train a child in the way to go, and afterward it will not depart from it. So it's also give a great emphasis to that. The spiritual angle to addiction is quite enormous, and when we look at what the devil do, it comes in various ways, in obsession, possession, and the rest. And it gives a bait for an individual. Initially, we look at it that, oh, I enjoyed it, I have a good feel, oh, I'm bold, I'm confident, oh, I'm looking good. But it's just a bait. But in the long run, it wrap him up and more or less engage him and make his destiny not to be achievable. So, and that's why, interestingly, in the science world, spiritual therapy has been emphasized a lot. I mean, in so many countries, a lot of spiritual organizations are into rehabilitation programs because it's plays a significant role in their recovery. Getting them to come to awareness of who they are in Christ, getting them to understand the power that God can help them. And that's what the 12 steps focus on, that there is higher power that you can look up to, that this problem that you've tried, you've done all you can to overcome, that you've not been able to overcome. And the 12 steps help them to recognize that higher power and start depending on it, and which the higher power is in quotes the God, as the case may be. So it buttress the point that spiritual intervention goes a long way, and to overcome what the devil has messed up. And believe me, it's created a lot of havoc globally. So I think we should welcome spiritual intervention right from the word go. In prevention, spiritual intervention plays in role in identifying those that are struggling with some challenges, like our Father and the Lord, the Breaking Bad Habit Decision That Guarantee Your Tomorrow. They are very instrumental materials that help to straight line. And, for us in Dream Center, where we have Teenagers Church that has a lot to build the pro-sobriety attitude to life, build social skills that help them to be able to have confidence, to be able for them not to cave under pressures, and to be able to identify their goals in life. And all this contributes significantly for a life without drug. So these are the points I have for now.
If you know anyone going through this, you might really need to introduce them to Jesus. Thank you very much, sir. Pharmacist Adesonya, please, ma, are there any drug combinations people take without realizing that it carries the risk of possible addiction? Thank you, ma.
Thank you so much for that question. Yes, there are. To answer your question, yes, there are combination of medications that can be used that do carry addiction risk. And I will start off by saying that a lot of this combination, most of the time, especially when prescribed, they start legitimately. Okay, but it's important, legitimately meaning that because the person has an indication to use one or more of these drugs. However, it's very important that the risk of addiction, it's important that we know that the risk of addiction then increases with long-term use or with escalation of dosing or things like multiple prescribing with different doctors and some factors like that. So looking at such combinations, I'll take a look at some common ones, bearing in mind that we've gone through some of these prescription medications that have a high addiction risk and why they do carry that risk. One combination would be opioids, like we talked about, opioid pain medication, when this is combined with benzodiazepines. We looked at what we use benzodiazepines for. So we have examples like if somebody has a severe pain and has to be on an opioid like hydromorphone or something strong, and the person is also using something like a benzodiazepine, for example, diazepam, which we commonly know as Valium. And the reason why this has a very high addiction risk, this combination, is because they are both depressing your CNS, which is basically the central nervous system. And so when you are having that effect repeatedly, every single time you are taking this two group of drugs around the same time, this increases a possible risk of the person getting addicted to the medications. Another combination you will see in these examples we are talking about is combination of the group of drugs that we mentioned earlier because of their effects on the brain. Another combination is when you are using sedative medications together with these opioid medications. Remember that I said earlier that the thing with these sedative drugs is that they are to be used for the shortest time possible. They are not drugs that you are supposed to be using long term, even alone, even on its own. Now talk less of when you then combine it with an opioid medication. That also has a strong addiction risk because people get addicted to that numbness that they feel. That's the way they regard it, especially people that are going through trauma, that don't want to feel anything at all. So you see them using this kind of drugs, and this combination just puts them in that state of not having to feel, as it were. Another combination is when a person is taking benzodiazepines. These are medications that I said, remember, anxiety, insomnia, panic disorders, the Ativans, the Valiums, and you're combining that with alcohol. Even though alcohol now we are categorizing as a substance, but still what alcohol does when you use it with any of these drugs is that it amplifies that feeling of being on a high. So that's a combination that you definitely don't want to use. When you are using a strong opioid medication or any of the drugs we talked about, do not combine with alcohol. Another combination that is often underestimated and overlooked is the combination of these opioid drugs with medication that we call gabapentinoids. So these are a group of drugs like gabapentin, pregabalin. These are drugs that you see in people that have nerve pain. This is common in people that have had maybe like a major accident, or people that have issues with their nerves, sciatic nerve, and things like that. You see them on neuropathic medications. These are medications that are used targeted or at the nerves. And so when you are combining this with another opioid medication, there's a strong risk of addiction because there is now an enhanced euphoria effect. And Dr. Monijo explained what that means and how that is happening in the brain. So that is very much enhanced. And I actually personally, I wasn't aware of that addiction risk until I started practicing recently and started seeing that, especially when you see the youths and people that have had like really bad major car accidents, are really addicted to that combination because of that enhanced euphoria effect that they get when they use it. Another combination is the stimulants we talked about with people that need help with focus and concentration. When you add this with benzodiazepines, we talked about what those ones do. It gives this up and down cycling pattern that people that are addicted to drugs enjoy. So they enjoy the stimulatory effect of the stimulants. It gives them energy, it gives them focus. They are up, they are energized, and then they enjoy the benzodiazepines because it makes them feel cool, it makes them feel calm. So there are some people that's the effect that they realize that they get when they get that combination, and that's what they are addicted to. And the last one I would like to mention is opioid medication. Again, you will notice that I've been mentioning opioids a lot. So this should enlighten us to the fact that when we have to use these medications, we should be very wary of whatever it is, or very aware of whatever it is that we are using in combination with them. So we have opioids and also with muscle relaxants. I mentioned muscle relaxants earlier. So it also gives that combined effect of reward in the brain, and then it also gives that combined sedative effect. So these are just some of the combinations that are commonly used but do have a high risk of addiction if not monitored properly and if not used appropriately. Thank you.
All right, thank you so much, Ma. We are grateful. So we're going to be moving to the next question. And the question will be directed to Dr. Munija. Yes, Ma. Is recovery from addiction truly possible? And what does that process look like medically and spiritually? Thank you, Ma.
Okay. Thank you very much, sir, for the question. Yes. Is recovery from addiction, is it possible? It is very possible. Very possible. Physically and mentally, it is very possible. Okay. Let me talk about or spiritually rather, and mentally, it is very possible. First, mentally, which is well, what we practice, is very possible. And then that's why we I want to promote awareness and really advocate that if people are abusing substances, they should bring them to the hospital, because there is a treatment plan, all right, that can help those people get over the addiction problems. Okay. So it depends on how the patient presents. And when Dr. Yankola was speaking, he made mention of the fact that early presentation is very, very important. But unfortunately, what we normally experience is that most of our clients present very late. They wait until the psychosis develops. They wait until the patient is destroying things, and however, they have been seeing telltale signs. They've been seeing the person maybe perceiving smoke and all that, but they would feel that is dependent on how the patient presents. So however the person presents, okay, treatment starts. Okay, and treatment will be both physical and will be psychological as well as social. Okay, because the implications and complications are also in those domains. So the treatment procedure is usually in that light. So however the person presents, we assess the person. The first thing is assessment. We assess the person, and however each client or each patient or individual, their conditions or their presentations are very different. And so the treatment plan for issues like this are basically, they are individual specific based on the presentation. So, but in general, what we do is assess the person. And if the person has physical health problems, okay, we deal with that and we take care of that, we treat that. And then they identify their psychological health problems, of which addiction is one psychological health problem. Then we manage that. Okay, we manage that, we deal with that with a lot of psychological interventions, a lot of psychological therapies, talk therapy sessions that we take our patients through different psychological interventions, different psychotherapy sessions they go through. Okay, one that has proven to be a predictor of good outcome is what we know as Alcoholics Anonymous, a 12-step program. And in that 12-step program, the patient is made gradually to, with talk therapy, they're taken through different sessions. And how well they do well with a stage, they move on to the next stage. So we take them through the stages of what we call the stages of change, okay, in which somebody who abuses substance, who is not even aware at all of negative impact, is made to, begin to see that this substance could be harmful, to them. So we take them through those processes to a point in which they can personally, begin to see, and they can actually see. And then we do we also add some maybe cognitive behavioral therapies, helping them to change their thinking style, their thinking pattern. We do what we call also motivational interview, make them really see the harmful effects of these substances in the long run, of which some of them might have come down with some of those harmful effects as we talk about. So we take them through all that, this different psychological intervention, take care of the psychological problems, and then we also address the social, because we believe that we must take care of the social problems. Some social problems may even be the trigger in the first instance of why the person has gone into substance use. So we must take care of that. And that's why it's multidisciplinary and it's encompassing, in that it doesn't only involve the patient or the client. It also involves the client's relatives, because we must build a strong social support for the person. Everyone that has a stakeholder in the person's life, that is quite important. We might need to call them to give that support to help the person. And also now coming spiritually, there is nothing our God cannot heal. Our God is a healer. The Bible says, I'm the God that healed, is the God that healeth thee, is the Jehovah Rapha. So there is healing in the house, there is healing in Zion. God is still in the business of healing his people. And when God heals us, he heals us. He made us. Man is a spirit, he has a soul, and he lives in the body. So God heals everything, every context, the tripartite nature of man. God heals that. He heals our spirit, he heals our soul. And that's where, addiction is like, it's a soul problem. Because, the person, anything that affects a person's will, anything that goes beyond the person's will, it's something that the person has no control over. And let's remember when Dr. Aikola was describing addiction for us, he made mention of what? Loss of control. That there is that loss of control, which is one of the C's. So anything that has gone beyond your control, you need a higher force. And that's one of the things we do during rehabilitation, to emphasize that you need a higher force, you need God to come in on the scene. And studies have shown that, going this way helps them recover, gives us a better outcome, a better prognosis from people that have been addicted. When they come to God, they realize God empowers them. When you come to God, God gives you the strength to deal with substance use, because Christ in you gives you the strength to ward off the flesh, to crucify the flesh. He gives you the strength to crucify the flesh, to bring your flesh under, to bring that desire, to bring it under. So I don't know, I from wherever you're joining us, if you're having issues with drug and it's beyond you, you recognize it's beyond you, this is an opportunity for you to come to Jesus. He can heal you of that. And testimonies abound of people that have been under addiction of multiple substances, even if yours is not even psychoactive substance. Maybe you're addicted to food, you're addicted to some unpleasant behaviors, maybe pornography. Like, Jesus can heal you. This is a time for you to come to Jesus. And I don't know, I want to give you this opportunity. I don't want this opportunity to slide. If you're here, you're listening to me. Jesus is in the house, and this is why we have come to do this intersection between faith and medicine. And he's here. He hears you. Those secret cries, those times of withdrawal symptoms, and you have to go back and take this substance. He knows and is ready to help you. But you need to come to him first. I don't know if there's anyone like that. We can bow down our heads now. And I want to give you that opportunity to come to Jesus. And I want you to put your right hand on your chest and just say after me, Lord Jesus, I come to you today. I recognize that I cannot help myself. I recognize that I am sinking in a pit. And I know that you can help me. I accept I ask you, come into my heart. I ask that you heal me and you give me the strength, you give me the grace, you give me the discipline to deal with this substance issue. Thank you for saving me. In Jesus' name I pray. Amen. So wonderful. Just as that, you're welcome to God's family. You can drop your details for us in the chat box, and definitely we'll reach out to you. Jesus is still in the business of healing. Thank you so much. Thank you, sir. I hope I've been able to address my question. I could not, let go of that opportunity. Thank you, sir.
Thank you so much, Ma. We are so grateful. Yeah, with Jesus, recovery is possible. Thank you so much once again, Ma. So we're going to continue with the next question, and the question will be directed to pharmacist additional. So though the question has been answered slightly by pharmacist Adesanya, so we want you to be brief about answering the question. So how does prescription drug misuse start, especially among the adults? How does prescription drug misuse start, especially among the adults? Yes, ma'am, you're welcome, ma'am.
alternatives exist for people dealing with stress, insomnia, or chronic pain? Thank you, ma'am.
Thank you very much for the question. Yes, stress is part of life. I always tell my clients that stress, you cannot run away from stress as long as you're on this earth. You would always be faced with stress, okay? So how to deal with stress? We must have coping styles. I mentioned some earlier that we can use, okay, to deal with stress. Exercises is one, which is very, as studies have shown that this helps a lot to relieve emotional stress and even bodily stress, okay? And I also talk about ventilation. That's talking about your problem, not bottling it up with yourself. You're not talking to anyone. You just keep bottling up your problem. You could explode from that. That's just by the way, but studies have shown that even an English adage says that a problem shared is a problem what half solved. Okay, so when you talk about your problems, you feel better within yourself. So just learn to ventilate appropriately. Talk to somebody about that. Then having a positive appraisal, of the situation, no matter how distressing it could be, no matter how crazy in quotes it might be, you must have it. There's a positive side to it. Okay, that's one good coping style. So we all have different ways of coping with unpleasant situations when we find ourselves in them, but we must learn some healthy coping styles. Okay, so healthy coping styles will really help. I mean, we'll go a long way, in improving our mental health. Addiction or substance use is an unhealthy coping style. So that's why we should guard against that. So other coping styles we can use, having a positive appraisal. I've talked about that. Humor, humor is one good thing. Just find a way of finding something funny about it. And humor is one thing that we really do in Nigeria a lot. No matter how terrible the situation is, or no matter how bad it is, people will find something funny to build from it. Subsidy, or petrol is now 1,000 naira. People will just find something funny. Those are coping styles. You just laugh about it and ease yourself of that tension. And then that will even give you some immediate relief. You are not as bottled up, you are not as choked up as you were before. So that will help. Humor is the one very fantastic thing. Like I had a friend that recently that just lost his wife, and we went to console him because it was very close to me. We went to console him. He just lost his wife, and he said, you see, somebody just, he has this humor way of, dealing with things. And it began to encourage those of us that went to encourage him, because it was just made everything funny, and there is a way some people are gifted like that. That's also a very good coping way. Then problem solving skills. We must learn problems, or how to learn with problems. Okay, how to deal with problems, how to provide solution. Let's look critically. Where can I start from in providing solution to this problem? Okay, and then one good thing again is to know things that you cannot change. You must be ready to accept some things that you cannot change. You can't change everybody. You cannot change every situation that you face. You must understand, especially when it is beyond you. You must be able to accept what you cannot change, okay? And then learn to trust God, for things, okay? Because this is intersection of faith and medicine. Then you must also learn to cast your cares. The Bible says we should cast our cares upon him, for he cares for us. So there is nothing my Father in heaven cannot visit. So learn to commend everything to God in prayer. Have a close building relationship between you and the Lord. Come to the Lord, and then you build that relationship. You talk to God about any problem, and then he steps in and intervenes. Even when the problem is even beyond you, you have a God that can, Bible says that the hearts of the kings are in the hands of the Lord, like rivers of water. He directs it whether so he wills. He can do that for you. You can't go there and keep bothering. Maybe you have a street boss, or that is a matter that is just beyond you. What can you do about it? You can pray about it. You can talk to God about it. Those are all good coping styles, coping mechanism. Worship, singing, these are good coping styles that helps you build up your spirit. Instead of sitting down there and wallowing in your problems, and you end up having depression, get up there, praise God in every situation. Bible says in everything you give thanks, no matter how bad it is, give thanks to the Lord. Do some worship, do some joy. My mother in the Lord would keep saying, do joy, even no matter if you don't feel like it, just do some joy. And then you see that your spirit is lifted, your soul is lifted, and then you can look clearly and begin to see things, find solutions and deal with the problem. Okay. I don't know if I dealt with the problem with that answer. I hope I've been able to. I hope I didn't leave out an aspect of that answer. Of that question.
Yes, ma. Thank you very much, ma. Our last question goes to Pharmacist Adesonya. Please, ma, what can people who are legitimately on prescribed medication with high risk of addiction do to avoid addiction?
Thank you so much for that question. I'll start off with saying that needing a high risk medication does not mean that a person will get addicted to it. So I don't want anyone walking away with that fear that, oh, because you are using one of these drugs, or you might be addicted to it or something, or you will be addicted to it. No, these medications can be used, these high risk addiction medications can be used safely, as long as there is the right education, close monitoring and support. I think that to answer this question thoroughly, we should look at what are some of the predisposing factors that can increase the risk of addiction, and then what should be your own responsibility as somebody who is taking these drugs. And a lot of them have already been addressed. From Additional already talked about some of them. So one of them that increases addiction risk is prolonged use of medication more than the required time. And I'll point out here that if you are using any medication, but in this context now we are talking about high addiction risk drugs, be very intentional. Be intentional about having an understanding of what medication you are taking. You don't have to be in the healthcare field to have a basic understanding of what the name of your medication is, how are you supposed to use it, how frequently are you supposed to take it, are you supposed to take it on a schedule, or are you supposed to take it only when needed, and how long are you supposed to take this for. There are people that have been given a prescription that they are supposed to use for only 1 month. And then after 1 month, they go themselves to a pharmacy or a patent medicine vendor and they go and get the medication again without involving their doctors. Okay, so be very intentional about gaining knowledge on your medication, knowing if you cannot ask your doctor at the point of prescribing, when you get to the pharmacy, talk to the pharmacist and ask questions. Ask what you are expecting from the use of this drug. What is the benefit you're expecting? What is the side effect you're expecting? What will happen if you use it more than this set period of time? What is the dose that you're supposed to take? Ensure that you have an understanding of this medication if you have to take any of these drugs. That is one thing. Be intentional. Another predisposing factor is dose escalation. We mentioned that earlier. And what would be your own responsibility? I want to encourage us, if you are on any of these high-risk medication and even medications generally, take your medication exactly as prescribed. Okay, take your medication exactly as prescribed. Don't take your medication exactly as prescribed, not more than prescribed, not more often than prescribed, not just in case. Okay, so don't say I'm taking this just in case I have pain, so I'm going to take this now just in case I come down with pain. Take your medication exactly as prescribed. If you are told to use a pain medication only when needed, there's a difference between taking a medication 1 tablet twice daily and taking a medication only when needed. Okay, so that means only when you need it for that reason that you saw your doctor for. All right, so that would reduce the risk of escalating your dose above what you are supposed to be using. So avoid increasing your dose without informing. Always ensure that you are carrying your doctor along if you realize that your dose is not sufficient enough to manage your pain or manage whatever indication you are using any of these drugs for. Another predisposing factor, and Pamadeshina already talked about this, is when you have multiple prescribers or poor follow-up. So what would be your responsibility? And I'll give you a case scenario. You are based in Lagos and you saw a doctor in Ibadan or in another city, or you went to the north. Now, there is a great possibility that the person you saw in that other city does not have a comprehensive medication list of what you are taking. Now, we are talking about our responsibilities here now, right? So it is your responsibility, if you know you are seeing someone else or you are going to another pharmacy aside your regular pharmacy or your regular prescriber, to inform them of what you are currently taking. Okay, you can have a medication list on your phone, you can take a picture on your phone, or you can just practically carry your medication containers or vials along with you if you have to see another person, because there's a great probability that they don't have your history and they don't have your comprehensive medication list. So this will prevent the risk of multiple prescribing of the same medication. This will prevent the risk of those addictive combinations we talked about. Because if your doctor is aware that, oh, she's already using one high addiction risk drug, they may not prescribe another one for you for a chronic condition. Okay, so practical things that you can do. Our father in the house, Daddy, has already taught us that if you have to use medications, you should prayerfully use medications. Join yourself to the benefits that is expected from that drug, and disconnect yourself from every negative side effect, and this includes addiction risk. Okay, if you have to use any of these medications, prayerfully use them each time that you have to use it. Other things that you can do if you have to use this drug to reduce the risk of addiction is watch out for early red flags. Okay, watch out for early red flags in yourself, and this goes for parents. If your children has to use any of these drugs, or your family members, watch out for early red flags. What are the early red flags you can look at? If you are starting to think about the medication outside of the medical need of the drug. Okay, if you are using it for emotional relief, you're using it for stress, emotional relief, rather than the original indication of the drug, that is an early red flag. If you are feeling anxious once your medication is running low, now there is the regular calm anxiousness where, oh, my medication is running low, I'll stop by the pharmacy and pick up, or I'll book an appointment with my doctor. But if you are beginning to feel so anxious, so antsy, just because the thought of the fact that that drug is already running low, that is an early red flag. And then if you are needing higher doses for the same effect, that is an early red flag. Another thing you should do is, if you have to use any of these drugs, build non-drug coping strategies. Okay, we've said the indications of this group of drugs, right? So don't find yourself in a situation where medication is the only tool that you are using. Dr. Monijo gave us some other things that we can do alongside. Don't find yourself in a situation where you are managing chronic pain and medication is the only thing that you are using. Incorporate non-drug strategies. If you are dealing with severe chronic pain, what about physiotherapy? Okay, what about relaxation techniques? What about heat therapy, ice therapy? These are things that can be used alongside with medication so that you are not dependent on it. Another thing you can do if you're having anxiety or insomnia, there are also sleep strategies, maintaining a healthy sleep hygiene. There are things that you can do such that you are not dependent on the sleep medications. Okay, if a person is dealing with ADHD, poor focus or concentration, you can start building structured routines. So alongside the use of these drugs, also incorporate non-drug strategies that can also help. Please remember that don't let medications be the only tool that you are using if you have to use any of these high-risk drugs. And then avoid mixing these medications with other high-risk substances. I talked about how alcohol amplifies the effect, and even do not use them. It goes without saying that you shouldn't use them with also street drugs. And then lastly, have safeguards around you if you have to use this. So for example, do not share your medications with anyone. Do not use another person's medication. So somebody was prescribed this for their own pain, and then you then collect from the person, and then you start self-medicating on your own. Instill that safeguard. See your own doctor for that particular reason. Store your medications securely. Do things to avoid the risk of taking more than is prescribed. So for example, you could get like a blister pack or a pill container that has spaces for each dosing of the medication. This will reduce the risk of you escalating the dose or taking more than is needed in a day. And most importantly, if you notice any of these red flags or notice symptoms of addiction, normalize asking for help early and don't keep quiet. Thank you.
Thank you so much, Ma. Thank you very much. Oh, wow. This discussion has been a very, very insightful one. We are very grateful to our panelists and our keynote speaker. Now we have questions. People have asked questions that they need answers to. And we're going to be going right into that now. Our first question actually still goes to pharmacist Temitope Adesoya, Ma. Yes, Ma. So let me ask this one. So someone has asked that does
Okay. No, I think I got it. Thank you. Thank you. So, okay, it's on the screen. Thank you so much. Thank you, Ma. And I appreciate the person that asked the question. The person said, does neuroadaptation happen in the use of blood pressure medication? So just for the sake of everyone present, I would just mention briefly what neuroadaptation is. And it's basically what happens when your brain changes its structure and function in response to repeated exposure, most times to a medication, but it can also be due to repeated exposure to a particular behavior or repeated exposure to a stress or stressful factors. So most of the time we see this neuroadaptation happening in the brain when we are talking about these addiction risk medications, because the brain, remember that the brain, these medications are acting in the brain, most of them, right? Not all, but most of them. So we commonly see this with these drugs. Now, regarding blood pressure medications, it does not apply to this because blood pressure medications act differently. So we see blood pressure medications targeted at blood vessels, targeted on in some cases, some are acting directly to reduce contraction or reduce the force of contraction of the heart or the rates. Some are acting on your kidneys. Blood pressure medications work in different ways. So they don't they work in different ways to reduce the blood pressure. So in cases of blood pressure medication, to answer the first question, it does not apply in these cases. Neuroadaptation does not apply in blood pressure reducing medications just because they act differently and they act on different body systems. Now, the person also said that, is it reversible? Yes, neuroadaptation is reversible, and this usually commonly occurs when you are weaning off a medication. That's the best way to reverse the effect that it has on the brain and for the brain to be restored back to the way that it was before. So that will come from gradually discontinuing the medication that had that effect on the brain over time, gradually discontinuing it, and then that's the way that it gets reversed. So thank you.
Thank you, Ma. You still have one more question. So someone's saying that, well, good morning. About an individual who has become addicted to NSAIDs as a result of chronic pain. In a case of rheumatoid arthritis, I have seen a lot of such cases in the UK recently. What do you advise about food addiction? I think that's the second.
Just for context, NSAIDs, NSAIDs stands for non-steroidal anti-inflammatory drugs, and these are medications that help in treating pain, managing pain, but they do so by reducing inflammation, which is a strong factor which is a predisposing factor in a lot of cases of pain. So in people that have rheumatoid arthritis, yes, there are a lot of cases where they deal with because majority of the pain that is presented in a patient with rheumatoid arthritis is inflammatory. So it is common to see people with this condition dependent on NSAID drugs. Now, the first thing we should know about rheumatoid arthritis to the person asking this question is that it is an autoimmune disorder, unlike osteoarthritis. So this is an autoimmune disorder. So for we to even treat that condition, the person is supposed to be taking another group of drugs, chronically. And this group of drugs help in reducing the risk of severity of rheumatoid arthritis, reducing the progression of rheumatoid arthritis. So what happens when a person is consistent on taking this drug daily, these medications, group of medications that is targeted at the autoimmune condition rheumatoid arthritis, the person sees a reduced, there's a reduced time capacity to be taking the NSAIDs. I don't know if that makes sense. So what I mean is, if it's like somebody taking something chronically to manage a chronic condition such as rheumatoid arthritis, they call them disease-modifying anti-rheumatic drugs. So if a person is a rheumatoid arthritis patient and is not taking any of these drugs, the person will be dependent on taking things to manage the pain. Because if you are using these disease-modifying anti-rheumatic drugs, it will reduce your need to take medications for pain, because this drug will help in maintaining the disease as a low severity. So in such cases, using NSAIDs long-term is definitely detrimental to the kidneys. So that is a very high risk for people that are taking NSAIDs. So it's very important that NSAIDs should only be used for the shortest time possible. For example, when the person has a flare-up of rheumatoid arthritis, then they can use the NSAIDs for the shortest time possible, and then they are back to their regular medications. So that's how I would answer that question. And then the other question said, what do you advise about food addiction? People commonly underestimate that this exists, but it actually does exist, where people are addicted to food. They use food to fill some sort of gap that they may be having. Some people have been traumatized by one thing or the other, or when some people are in a very high stressful situation, they use food as a compensation. Food addiction does exist, and if you find that you are eating not because you are hungry, not because you particularly like that thing, but just because you want to eat. The same way a person is not, they just want that feeling that they get when they eat food. So it's very important that you speak to a specialist. Some people are able to get off this on their own. I must point that out. But most times it's usually advisable and recommended that you see a specialist, and there are treatments available for people that do have food addiction. Thank you.
Okay, thank you very much, Ma. Thank you so much. Our next question is directed towards Dr. Anyokola. Please, sir, someone is asking that, can there be a brief recap on people who got addicted in the Bible?
Can you hear me now? Yes, thank you so much. Yes, as I said in the presentation, we could talk about the lots at the point God drunk, to the point that his daughters were the one that have to call, at the point that he was having some undue access to them. And likewise, the proverb talk a lot about people getting drunk, and how it could really affect their well-being. I mean, their spiritual well-being and generally their life. So the Bible mentioned a lot about people getting Noah also at a point got drunk. So all these are points that we should, that's spiritual, that the Bible has mentioned that using drug, even in the Bible is not, did not promote continue using drug. So all these are things that we should bear in mind when we are looking at addiction, that the Bible has talked about it in various platforms, that addiction should not be promoted, and those that use drug, then they should seek for help. So I don't know if I'm able to answer that question.
Thank you, sir. We have a very interesting question here now, and it's directed to Pharmacist Additional. Can someone be addicted to a nutritious meal? Earlier, Pharmacist Additional already answered that. When she answered the question, someone asked about
had diabetes, and then the doctor told him that you shouldn't eat pounded yam. And then by the time he went back for another visit, they said, Papa, your sugar level glucose level has skyrocketed. And I said, what did you have for lunch? And he said, he had pounded yam. And I said, what soup did you have with it? He said, it was there salt there. He said, can you also eat stew without salt as well? That's just an enlightenment. But there are some people that by virtue of their background, their culture, there are certain foods that they are more predisposed to. They like pounded yam, they like vegetables, they like fruits. But then the problem becomes, arises when you had the same food yesterday, and then there's this compulsion, there's this crave. Like Farmer Adesina was saying, that you just cannot do without it, or you're taking it to overcome a certain kind of emotion as it is. That's when there's a thing to it, and you must speak to the right person. And then when we say speak to someone, please, I also want to emphasize that we should speak to the right people. There are people that feel like, okay, I'll speak to my friend, I'll speak to my neighbor, and then they guide you, in the wrong path. They tell you to use certain things that on the long run would even interfere with prescribed medications. So speak to the right people, open up to, your healthcare provider, as it were. And like we also mentioned before as well, certain foods could also be prepared with things that contain, ingredients that could lead you to always want you to, eat those particular foods. There could be spices, there could be, condiments that contain certain stimulants that probably, that's the reason why you always enjoy or have a particular feeling when you take that particular, nutritious meal in quote. So you should be deliberate about the content of what you're eating. If they are packed, meals, that you could always check their content, what they contain, the calories, the ingredients. You can always go through it and see whether those things that actually have been mentioned could have certain side effects, or maybe your body doesn't accommodate it as well as it should. And the takeaway is always speak to someone when it feels like you really cannot do without something. That person could be able to evaluate that particular food you like with you, and then we could see whether there's something to it or it's just your own personal predisposition, as it were. Basically, aside the spiritual aspect that maybe, here in Nigeria, where certain people would prepare meals and then, there are some, spiritual aspect that makes you always want to come back and buy it. Well, I would say that it is either, by virtue of background, you naturally would like that, but if it becomes compulsive that, you can't do without it, you want to use it to overcome certain emotions or something, you need to speak to a healthcare provider, and then we'll evaluate what the content of these things are. What have they used to prepare it? Probably there's something within that thing that, is making you always want to have to take it. So that's the way I would, answer that. I hope it helps the person. Thank you very much.
Okay, as we continue to the next question from the participant. Okay, question number 4. What is the role of the government, community and religious organization in curbing the menace of
Yes, the society and everyone has significant role to play when it comes to addiction being a menace. And we may need to look at it from individual to the community to family to religious organization, and the prevention aspects. Everybody can participate in the prevention. Like OAD is doing now, creating awareness. Unraveling the mystery around it, so that people can be willing to speak up and overcome the stigma, because one of those things that has made it difficult for people to get treated is the stigma associated with addiction. So it's a good thing that everybody can come hand in hand so that they can start working on it. Individually, let's prevent it. Let family also play significant role in building a good start for all our kids, and so that they can live a meaningful life. The community also have a role to play. Once you identify someone that you think has some behavioral problem, and you are thinking probably he has drug problem, then you can encourage him to present in a mental health facility. Community can set up a day program that could create awareness, or even can screen, that can screen, but not just screening alone. It's also important that you refer them for treatment, those that are identified. And just as we've talked about it, that there are some risk factors that could also be of emphasis. When somebody has risk factors, the benefit of you identifying risk factors is so that you can be able to catch them before it gets out of hand. So if people have maybe family history of drug use, these are people that have high risk factors. Someone that has adverse childhood experiences, these are risk factors. Dysfunctional family, these are risk factors. These people, there are some package of care, package of programs that have been found that can help them significantly. And government needs to play a significant role, and we hope that one day we'll get there, whereby significant attention is given to, for instance, like prescription drugs in other climes. For every medication, they can trace it to the end users, so that to avoid diversions and being used for wrong purposes. So all these things are very important. Regulations, creating policies, program, interventions in school. Even religious organization, can also play active role in promoting a sober environment and well-being. So everybody has significant role to play, but we need to be informed first, so that we can know what to do. But NGOs can participate. Everybody can participate, and I think if we do so, we'll reduce the menace of addiction in the community, and also its negative impact on the society.
Dr. Tosin Omanijo. The question is that how can we encourage people who are addicted to drugs find it easy to open up on their drug use so that they can also get help on time? And then she said, and the person says, as a medical personnel. Also, why do medical practitioners slip into drug addiction? Their knowledge, and what's the way forward, ma'am?
Okay, thank you very much for that question. Okay, trying to.
I can read it again.
Okay, thank you.
Okay,
yeah,
ma'am.
just
So
the first aspect.
Okay.
Okay, yes, I get it now. How can we encourage people to open up? Okay, to talk about their substance use issues. Dr. Akinkola just made mention of one thing that actually prevents people from opening up when it has to do with their substance use behavior is the stigma that is associated with it. You know, so there's a need for more education, more awareness, to deal with this stigma issue. Stigma is one of the major causes of people not opening up. And so, but as we raise more awareness, as we enlighten the public more about getting rid of stigmatization another thing that can help people open up is maintaining confidentiality, and that has to do with how we get to maintaining confidentiality. And another thing is also privacy. Must be able to maintain clients' privacy and confidentiality. Sometimes you just see people talk to people, in a group of I want to talk to person A, and A is in the company of B, C, D, E. And it's not easy for him or her to open up, because it's not easy for such a person to open up about their substance use issue when they're in a group. Even if that group, is consisting of their immediate family members, they might not be so confident to, open up like that. So it's better to exclude those people and then have a one-on-one chat with the person involved, and that will help the person to open up more. You understand? So maintaining confidentiality, privacy that will help people in opening up. And then we must also learn to show empathy. When the person that you wants to get the information knows that you care, you are not here, I'm not here to just like Dr. Akinkola said. Just like Dr. Akinkola said, the job is not left to just the medical personnel only. Everybody. You can talk to your pastor. You can talk to your somebody that you can trust. You can talk to them about your problems, and they will definitely help you. And that's why we're educating the general public. Okay. As a child, you can talk to your teacher. As a secondary school teenager, you can talk to your teacher. You can talk to your parents. You can talk to your mom, your dad. You can talk to somebody that is trustworthy and you know exactly where to go about in helping. So those are the basic things. For someone that shows care, you show care, you maintain the person's privacy, and then you don't stigmatize, the person will definitely open up. Then the next aspect for him, okay, for medical personnel, okay, how come they end up being addicted, having the knowing, I mean, with the knowledge they have. One thing that, in fact, researches and studies have shown that doctors, psychiatrists, and anesthetists are at the highest, have the highest prevalence of substance abuse, especially of medications and the likes. One major issue is easy access. A doctor you are the one that prescribed for clients, so you authorize prescription, so you can actually have access. So they have access to these medications. So it's easy for them to access these drugs. Unlike the general populace, most medications that have addictive properties are highly guarded. They are not prescription, are not medications you can easily get over the counter. Without a doctor's prescription, you cannot get these medications. But for someone who is a doctor, of course, already you have access to it. So that's one reason. And then doctors tend to self-medicate. A number of doctors, they have complaints. Instead of seeing their doctor colleagues and presenting themselves as patients, they don't want to be associated with the fact that I'm a patient. No, they want to say I'm a doctor, I'm not a patient. So they self-medicate. And because they self-medicate, they know, okay, this can take care of this pain, this can take care of this sleep problem. They start taking it. And the first use, the next use, before they know it becomes a repeated use, and before they know it, they are hooked up on it. Another thing is that there is this perfectionism that is associated with doctors, health workers. In fact, here in a certain, they usually say, actually, doctor man sick. They forgot the fact that a doctor is also a human being and can have the problems that every human being has. The fact that you're a doctor does not exclude you, does not make you immune to the fact that you may be addicted. A doctor is also a person that has a brain, that has a reward system, that, can also be, addicted to these substances. So that perfectionism is also another thing. Then also the work schedule and this burnout also puts doctors or health workers at risk. You have to run sheets, you have to work long hours, and then you have to do a lot of sleep deprivation. And if you can't help it, and you're feeling sleepy on the job, you may have to you don't want to, but you may have to take stimulants to, get you up, active, and the likes. And if this is done repeatedly, before you know it, they get hooked up, they get addicted to the substances. And then, there's this fear of professionalism consequences. I don't want to lose my license. I don't want to be found wanting, despite the fact that I am tired. So I need to just push myself and push, go an extra mile. And when they can't help it, they might need to take some substances to stimulate or energize them to be able to function. So these are some of the problems. Then, of course, like I said, doctors are not immune. They're also human beings. They may have some comorbid mental health issues. They could have any problem any other person is having. They could have depression. They could have anxiety. And having all this, they could want to okay, I want to get something to take me off this depression. They can start taking substances, they can start taking alcohol, they can start taking other substances to just stimulate their mood and get them. And before they know it, they get addicted to this. So these are some of the reasons that I feel that can lead a health worker to this. Okay, I think I must have answered that question number 5. Okay, thank you.